Okay, so as she's mentioned here, erectile dysfunction, again, is one of the, what we call the triad things when we have prostate cancer. With three things we want. We want to get rid of the cancer, we want to get rid of incontinence, and we want to get rid of erectile dysfunction. Now, usually the best predictor of erections after having prostate surgery or prostate intervention is what was the quality of your erections before the intervention, okay? Those are some background information. So first we try medications. If that doesn't work, we try other things such as shots, such as pills that we stick in the penis. A lot of that is largely ineffective. So and then there's vacuum devices. Again, many patients don't like them. They can cause some pain, cold sensation. Vacuum devices just aren't very popular. Some people do very well with them. So after all of that, the next option, the main and the best option for a lot of people is what we call penile prosthesis. Now, penile prosthesis is fantastic. It's been around since 1972 or 73. Dr. Brantley, he actually is a urologist. I think he was a urologist. He actually discovered and actually invented the penile prosthesis. Basically, it's completely inside the penis. There are two different types. There's a type where they're just two rods that go inside of your penis. Okay, you still have full sensation, you still orgasm. You have good, and it stays erect. And basically, what ends up happening is they're just two rods that you can shape. So your penis is like this. You pull it down like this. When you're ready to go, you basically shape it up, and it's a beautiful thing. No medicine, no shots, no have to store the medicine in a refrigerator. It's with you. The erection stays firm all the way to when you're finished, and even you can go to when she's finished because it won't go down until you want it. This one won't go down until you bend it down. The other one, by the way, there's a lot of advantages to that one. I think it's the most underutilized one. I like these. There's another one. A lot of the patients, they want the three-piece. They call that the Cadillac, the high-end one. And it basically allows more of a natural erection. It's a pump. So you have a pump in your scrotum. You have a reservoir that holds the water behind your, it's a little in front of your bladder. It's behind your bone. And what you do is when you pump it up, basically the water from the reservoir goes into the cylinders that go in the penis, all inside, small incision. You only stay in the hospital a day, 6 weeks before you can use it. And basically you pump, like I don't know if you're looking at the Reebok pumps, but basically you go up, 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 and then when it's ready, you have it stays erect. When you're finished, there's a little release mechanism that you push that's part of the pump. The water will then go from the cylinders back into the reservoir, and you go back soft again. So it's a more natural, but man, it is over 90% satisfaction in the male, and females over 98%. I kind of wonder why, but there's a very high female satisfaction rate because, let's face it, as we get older, the erections the quality of the erections aren't quite as good, but with the prosthetic, it's as rigid as you want, and it stays there till you're done, till you put it down. So it is a very, very, very attractive alternative if you are not surgery aversive, and if sex is important, reliable sex is important for you. But it allows the intimacy. It allows you, because men as men, if we can't finish the act, it's like we don't want to hug and cuddle because our manhood is associated with finishing the act. At least many men are, not all, but many. So you give that man the confidence, therefore he's going to be more hugging, more tender, more connected to his significant other. So the prosthetic is a very nice. That's the surgical option, which is a very, very good. It's very commonly done. It's not some freak thing. It's not some people they go, but it's a really, really good option. And
at what point?
In general, after you've had the, she says at what point? After you've had the operation or the radiation, because sometimes you can get your ED a couple years after radiation. So typically after you're cancer-free pretty much, and that's all resolved, and you're continent, that's kind of resolved, and then you kind of want to start, getting intimate again. Typically you wait at least a year after a surgery. Radiation, typically it's already a year or two because it's usually your erections get worse and worse over time. And then you failed all the other non-surgical modalities, or you don't even want to fool with other non-surgical modalities. And the good thing is if you had prostate cancer, your insurance will cover it and very little out-of-pocket fee. But it really is a wonderful intervention in the right patient.